Welcome to channel Toxicology on board. Let us learn the question 4 in this particular video. The question 4 is about gasoline poisoning. This was one of the question which appeared in previous toxicology of board or recertification questions. Let's see what was the question. A farmer arrives at the hospital with the following symptoms. Usually few of the questions in the board certified toxicology exams you will have on case studies. So once again, let me go through the question. A farmer arrives at the hospital with the following symptoms: coughing, choking, vomiting, CNS depression, and cyanosis. Key words that you have to remember in the first part of the question is CNS depression and cyanosis. A few hours earlier, he was fixing his tractor which had stalled in a field during spring plowing. So before entering into the hospital, he was working with his tractor. Clinical findings include albuminuria and hematuria, something related to albumin as well as iron. So, which of the solvents would the physician suspect of causing the absurd signs? You have to understand that before a person is coming across any kind of poisoning, they will be entered into emergency department in the hospital where a physician will suspect because he is not yet sure. Based on the symptoms, he will suspect. Probably this might be the cause of those symptoms because certain times the patient who is coming to the emergency department might not be in fully consciousness where he will be able to disclose to what particular chemical he was exposed. This is the reason physician has to suspect. He is not yet sure at this point of diagnosis. Let's see what were the options given in this particular question. So this is a typical figure you can see. This is a vehicle and this is the person, the patient, the victim who is siphoning the particular solvent through oral route, through mouth. Option A was methanol inhalation from tractor radiator. Option B was dermal exposure to carbon tetrachloride used for cleaning. You have to remember CCl4 is the typical chemical or solvent which is responsible for causing hepatotoxicity. Many questions you will come across in the board certified exam about CCl4 poisoning and its association with hepatotoxicity. Most of the time CCl4 is also given with other chemicals which will cause synergistic effect, synergistic hepatotoxic effect. Few questions are also on CCl4 poisoning in the exam. Option C is ethanol ingestion. Option D is gasoline aspiration and siphoning. Option E is dermal exposure to ethylene glycol antifreeze. So if you look at ABCDE options, there is three types of alcohols: methanol, ethanol, as well as ethylene glycols. So few questions in the board certified exam will be on alcohol poisonings, type of alcohol poisonings, their signature of symptoms or findings through which you will be able to recognize which type of alcohol poisoning and what antidote or treatment need to be initiated. Let's see what was the right answer for this particular question for cyanosis. The right answer is option D, gasoline aspiration and siphoning. Let us read something more about gasoline and its poisoning. Gasoline aspiration is when gasoline enters the lungs and it can occur when siphoning gasoline with your mouth. Here you can see through oral route. The chemical is exposed through oral route. So there is a possibility that it can enter into your respiratory tract, enter into lungs, or it can enter into GI tract or stomach. Siphoning is the process of using your mouth or a pump to move gasoline from one container to another. Okay. Next, aspiration can lead to serious illness, including pneumonia, coma, death, and respiratory arrest. Other injuries and illness that can occur from siphoning gasoline include burns, Irritation of the mucous membrane in your mouth, throat, and stomach, because the route of exposure is through oral route. So the chemical might enter through mouth, throat, or through stomach, affecting all these linings. GI signs and symptoms. If a person swallows gasoline or breathes gasoline fumes, you should see a doctor and call the poison center, because previously we have seen that there is a possibility of death or respiratory arrest. Some signs of potential aspiration include fever, prolonged coughing a few hours after ingestion, digestive systems such as gastric reflux, abdominal pain, nausea, and vomiting. Neurological signs. In the question, you have seen the CNS symptoms such as headache, sleepiness, and dizziness. Hope you have understood through this video and question number 4 about gasoline poisoning and its important symptoms. Be curious. For any questions, please comment, like, subscribe, and follow my YouTube channel, Toxicology on Board. All the best for your exam. Thank you.